The three things that I want to make sure everyone is fully aware of are the risks of bleeding, which typically is not concern about blood loss in the operating room, but more post-operative bleeding. We send almost all of our patients home same day, so I'm usually counseling them and their family members about looking for something like swelling or trouble breathing the night after surgery. Exceptionally rare, but exceptionally potentially high consequence. So we do a lot to talk about that. We always talk about things like issues to the recurrent laryngeal nerve, which is the nerve to the vocal cords and runs right up behind the thyroid gland. I do all of my surgeries with a nerve monitoring tube, and we talk about how that affects how we make our decisions during surgery. We talk about issues with potential voice changes after surgery, some which are temporary, occasionally could be permanent. And then what I think is probably one of the bigger challenges in Graves' disease, which is the potential for temporary or permanent parathyroid and calcium problems. The thyroid is often enlarged, inflamed, really angry in Graves' disease, which is what does make the surgery, I think, technically a little bit harder and theoretically can increase some of those risks. So we talk a lot about how we try to prepare in advance. We do a lot of preoperative protocols to help minimize our risk of things like parathyroid problems. I talk a lot about if we inadvertently have to devascularize or take out a parathyroid, how we put that back in as sort of a safety deposit in an auto transplant little pocket in the muscle, trying to minimize risks of anything being permanent. And then we talk a lot about just deciding, who should be the person to do your thyroid surgery.